Hi everyone, my name is Josie Blake and I'm going to talk to you about right hemisphere syndrome, or also known as RHS. I will cover what it is, what causes it, the signs and symptoms of it, how it is diagnosed, treatment methods, and tips for individuals who communicate with others with RHS. So first we will cover what right hemisphere syndrome really is. It is caused by damage to the right cerebral hemisphere, which truly produces some of the most bizarre deficits that a lot of professionals have ever seen. The right hemisphere of the brain is known to be responsible for reasoning, memory, attention, and problem solving. Nonetheless, the right hemisphere plays very important roles in communication. This hemisphere processes non-linguistic and emotional elements of communication, such as prosody, so pitch, facial expressions, gestures, and body language of others. This hemisphere allows us to comprehend and understand the important emotions behind verbal communication. Thus, individuals with right hemisphere syndrome often experience problems in cognition, communication, and sometimes both. Problems in the area of cognition would include the areas of attention, perception, orientation, neglect, and constructional impairment, whereas problems in communication would simply include language and speech. Often individuals with RHS don't even know that they have any deficits in any of these areas, even if they are profound deficits. So carrying on, we're going to talk about what causes RHS. The source of damage to the brain that often lies on the right hemisphere is usually due to damage from strokes. Different etiologies of RHS create different deficits. So essentially, it all depends on the location and the severity of the damage into relation of the problems that the individual may present. Any damage to the right hemisphere, such as TBI or traumatic brain injury, infections, strokes, tumors, or seizure disorders can produce deficits in this hemisphere. So as you can see, this slide kind of has a lot going on, but it's really helpful as it divides the deficits and kind of presents it in a nice way. So as you can see, individuals with RHS can experience deficits in the areas of communication, attention, and neurological. Deficits in the communication component include facial recognition, which means that these individuals may experience an inability to perceive visual stimuli appropriately as a result of damage to the central nervous system. These individuals have normally functioning eyes, but the brain is just having a little bit of trouble processing what the eyes are actually seeing. As I have already spoken about, they have difficulty understanding that an angry face means that they are mad or at somebody, or a smiling face means that they are happy. These individuals don't really understand the correlations between these facial expressions and the emotions behind them. An individual with RHS will also have prosodic deficits, and those are kind of the same thing, but it has to do with the way a person speaks. So they may have difficulty understanding a person's utterance, usually which has some form of emotion behind it. Inferencing deficits go along with the other ones that I've listed above. These individuals have difficulty attaching meaning to certain things such as humor, sarcasm, or any other non-literal expression. Finally, discourse deficits includes difficulties with turn-taking in a conversation, topic maintenance difficulties. Essentially, this means that the person is just going to have a little bit of difficulty communicating with others. Under attentional deficits, we have neglect, and this is a unilateral neglect. It's really quite interesting. And a unilateral neglect means that it only affects one side of the body. So, and it's defined as the inability to attend to sensory stimuli from one side of the individual's body or environment. So an individual will often neglect their left side of their body. So this means that they have the inability to see or feel anything on the left side of their body. An example of this would be if they were eating a full plate of food and they only ate their right side. They were neglecting their left. This will affect the individual's basic needs of everyday living, as you can see from eating, which is really important in our everyday life. Sustained and selective attention deficits is basically exactly what it says it is. It is the idea that these individuals have difficulty staying alert and holding attention on anything for an extended period of time. They often ignore certain stimuli and often lose track of conversations because they cannot stay engaged for a long period of time. The neurological disorders include what is called anosognosia, and basically that is the inability to recognize when somebody has a problem. So these individuals often blame any problem that they are experiencing on somebody else. This can be seen in therapy if a child is struggling or somebody who has RHS is struggling with their speech. They will often say that it is the speech pathologist's fault when we all know that that's not the case. These individuals may experience depression, so they may have difficulty expressing emotion indicative of their true emotional state. They may experience visual hallucinations, which is the ability to perceive something visually that does not truly exist or is not truly there. So they may think that there is an apple on the therapy room when really there is no apple even in the room. Finally, these individuals may experience paranoid hallucinations. This can be seen through visual or auditory, and the individual would then perceive them as threatening to themselves. On how can this be diagnosed by professionals? The participants involved in this diagnosis can, but does not always include, the neurologist, the neuropsychologist, the occupational therapist, and the speech language pathologist. First, these individuals will establish background information and the neurological evaluation. This will be completed through informal tests. These informal tests will be looking at the cognition deficits and the communication deficits. Next, formal tests will be completed. These will include cognitive and language abilities, and they can be completed using batteries. Just to name a couple, we have the mini inventory of right brain injury, we have the Ross information processing assessment, and the rapid assessment of problem solving, but there is several more. So we have treatment. The first responsibility of a speech-language pathologist is to educate the family and caregivers regarding the nature of the right hemisphere disorder or syndrome, and then we provide the therapy to reduce or compensate for the deficits and to encourage rehabilitation at home when formal therapy is discontinued. For treatment, we have 3 goals in mind: to inform the patient of the caregivers about the nature and the consequence of the disorder, to provide the appropriate treatment approaches and techniques, and to encourage the patient and the caregiver to continue rehabilitative process outside of the therapy setting. Even though usually a period of spontaneous recovery follows damage to the right hemisphere, it is the role of a speech pathologist to maximize the patient's recovery and to facilitate a return to normal life, or close as possible for that patient in the severity of their syndrome or disorder. Finally, I want to just kind of point out a few quick tips for communication with individuals with RHS. We want to keep talking to the patient. We want to get the patient's attention before speaking to them. We want to talk slowly and allow the patient to process your message. Use short, one idea, easy to process sentences. We want to establish the context of your message before you begin to expand on it. Give the patient time to formulate what they want to say. Be attentive and look for cues in the patient's tone, facial expression, and behavior. Be empathetic and not sympathetic, and that is a super important one that I really want to point out. And we want to foster success whenever possible and be generous with your praise. And a couple don'ts. Don't finish their sentence unless they want you to. Don't interrupt them. Don't turn your face away from them. Don't talk down to them. And finally, don't allow them to be isolated. We always really want to include them. I have a list of a couple quick references if you wanted to learn a little bit more about RHS. Thank you for watching.